Have you been getting Botox for your crow's feet, but noticed that they never completely go away? I'm Dr. Sarah Allen, Chief Medical Officer of SkinClick. There are really three reasons why this could be occurring. First, what's your skin texture like? If you have rough textured skin, it's going to be more difficult for those lines to go away. And what do you do in that case? Well, you need to make sure that you are on the skincare basics, and that is a cleanser, a toner, an exfoliator, and a retinol. And when you complete that, and when you have that routine down pat, you can add in fancier products like vitamin C and some antioxidants. But the basics are imperative and you can't skip them. In fact, patients who use a cleanser, an exfoliator, and a toner alone notice a 70% subjective improvement in their skin texture over 4 to 6 to 12 weeks. The second most common reason that this can occur is because you're starting to lose structure in your face. One of the largest fat pads in our face is called the temporal fat pad, and that travels under your cheekbone down into the side of your face to form what is called the lateral cheek fat. And this is really all just one fat pad. But you'll notice as you start to get older, that is the first fat pad to go. So what will you notice at home? You'll notice that you have some hollowing in your temple area, and also you'll notice that you have a concavity. So you have a defect right here in front of your ear. So that's what starts to go when you start to lose that fat pad. And when you do, it doesn't matter how much Botox you put in that area, you're never going to be able to impact the crow's feet substantially unless you replace volume where volume has been lost. Now, the word volume scares a lot of people. Don't let it scare you. All I'm saying is you're restoring that fat pad that was there before and you're giving it structure again. The temple is one of my favorite areas to treat because it really serves as the foundation for your entire face. You can imagine if you reset structure here, that helps your under eye area, your mid face area, the nasolabial fold that so many people don't like, even improves the appearance of your marionette. And so it is one of the most underrated places, I think, to treat in the face. So if you have crow's feet that don't completely go away with Botox, you likely need to be evaluated for structural loss. And this is a very simple fix. You have a few choices here. You can either use a hyaluronic acid filler or a biostimulator like Hyperdilute Radiesse or Sculptra. But no matter what you choose, restoring that structure is imperative. Okay, the third reason that you may have persistent crow's feet, particularly in the lower portion, despite getting Botox treatments, is that your provider is not treating you low enough in your crow's feet. So when we treat the crow's feet, this is a circular muscle that goes all the way around your eye. It's like a purse string. So you can imagine if you treat one place, you relax the entire muscle. This isn't always the case in all patients, and some patients require treatment in the lower portion of that purse string muscle. What's another thing that you need to look out for? If your provider does treat you lower in your orbicularis oculi muscle is what we call it, that purse string muscle, you do run the risk of having almost a shelf when you smile in pictures. See? And so currently you can see I have movement along the side of that eye muscle. And I really like to keep a little bit of movement in patients there because it gives a much more natural look. You prevent that formation of a shelf forming, because you can imagine if you relax this muscle all the way, you're going to look like this. And your cheeks are going to look larger and your mid face is going to look heavier, and nobody wants that. How can you tell which might be going on? Well, here's a telltale sign. If you have a fan that runs all the way down the side of your face, it's likely structural volume loss, and you should be evaluated as such. So always trust your provider to have these conversations. If you're not getting the results that you want, you need to feel comfortable talking to your provider about that. But these are the three most common reasons that you have persistent crow's feet on the side of your face. If you found this video helpful, like, subscribe, and share with a friend who has their appointment coming up.